go with the athletics insurance changes. So I think it's a little bit of a couple. But is there anyone here that could explain kind of what these changes mean? Is that Dupler?
I think Dr. Brown, Coach Brown is here. Yeah, here he. Yeah. Hey, Coach Brown.
Did you hear my question? I did. No, that's okay. That's fine. So I'm curious if you could explain the changes that are being made, potential implications, and then also kind of about the insurance. Because I've had a lot of people that have been curious about this, kind of which athletic programs fall under this.
So in the past, our sanctioned athletic teams have all been required, all members, to participate in the athletic insurance program. And that cost has gone from $25 when I started here in Knox County to most recently $60 per student. We collect that money. As a board, it has been paid up front. That number was $449,000 last year. And then we collect from the families as they pay to repay that amount. This year, for example, we were $146,000 short of being able to collect the full amount for that number. That number has gone up significantly over the last few years, and there are a few board policies that are in conflict with the board paying for individual insurance for a student. So that's why the change in these policies are all connected, so that we can become aligned with policy and our practice. The amount has changed from what was been covered for the shortfall to this amount this year, which is actually more than we had budgeted in that line item to cover the shortfall. So to make us in line with other similar sized districts in the state who do not either require or do not offer supplemental insurance, the idea is to go with the same as the other school districts that are similar to ours.
So this insurance is additional insurance that would cover injuries during...
It is a supplemental insurance policy that covers above and beyond what their personal policies cover, and depending on what their personal policy is, that is different for each family and each student.
If they do not have a personal policy, does that prevent them from playing sports?
Well, everyone is supposed to have a personal insurance policy. We have never turned anybody away. They've been covered under this policy in the past. We are offering a supplemental policy that has been for years offered to every student, not just athletes in the county, through K&K Insurance. And that ranges from $30 to $38, I believe, for most things, and it is from $170 to $240 for football alone. All the other sports and everything combined is that lesser range. We do get many calls every year from families asking why they have to pay insurance when they already have insurance. As someone that's been involved in athletics, for those that use it, it is a good policy, but we end up not having a lot that use it, and those that do, it ends up helping them quite a bit.
From things that I've seen that could be changing and insurance coverage for kids in the state of Tennessee, is there anything that we have in place for students that may have a drop in insurance during the school year?
So TennCare is available to those people who do not have insurance. We do have a number of our families at a number of our schools that already do that. They were not allowed to use this supplemental insurance because TennCare is their primary insurance, and they were not allowed to use that. So we were requiring families that couldn't use this $60 supplemental insurance to buy a policy to fall in line with our practice. I don't know how readily available that is to somebody, say, in October or February or March to get on that, but we can obviously find that out as well.
Yeah, I would love to know because I'm definitely concerned about TennCare potentially dropping some people or there being barriers or any sort of forms, and I wouldn't want any of our student athletes to not be able to participate in things that are valuable to their education and participating in camaraderie within the school because of insurance. So I would love to know that. If they could, I guess, enroll mid-year, and what our plan would be for that.
Okay.
Mm-hmm.
Thank you.
Thanks. Ms. Templeton.
Thank you, Ms. Spike. And also want to thank Dr. Reiswick for your update last week. That was very helpful in explaining kind of the purpose behind these changes because we have 3 policies here. They're all kind of interconnected, and I understand the need to make sure that they all say the same thing. That makes sense to me. They're kind of, and I'm sorry for not putting my light on before because they're kind of all over the place in this list.
Yeah.
So, Ms. Spike, thank you for starting the conversation. And my initial question was about kids. I understand that technically kids should have insurance and TennCare is available, but that is not always the case. Is there a safeguard for all students to be able to play sports if it is financially not an option for them to pay upwards of $200 for them to play football? Or are we eliminating that today, Thursday?
Well, those same people, some of them did not pay the $60 insurance that the board paid for that went against policy. And
Sure.
I think against, correct me if I'm wrong, Gary, but state law for a board to pay for an individual policy for a student. And we have not done that in the past. These other policies are available, and I would guess we work with them to try to purchase those policies.
So we have avenues for them, people that they can talk to purchase or to figure out a sum that they can pay, or I'm just truthfully, I'm
So
just
these
curious
insurance policies
whether or
are-
not we're going to be telling some football players they can't play next year. I mean, I'm really concerned about that.
Okay. This policy is an agreement with that family and that insurance company. So that is what brings us in line with policy, because it is against policy for us to take out insurance for an individual person. So that agreement would still be with them and that insurance company to be able to do that. Now, how they come up with those funds would be, I guess we would have to work through those details with that, because I don't believe a school support organization is any different than the school board in purchasing insurance for athletes.
Okay.
I could speak on that just briefly. I mean, I think there is some confusion, Coach Brown, because I mean, what the Tennessee Code and what the state board rules say is that students and their families can be required by LEAs, boards, to pay fees, which would include insurance for extracurricular activities, right? Which is certainly distinct and apart from school fees, which are optional, according to the same rules. So what the law says is that that these fees can certainly be charged and can be required. I'm struggling to find anything that outright says that the district can't provide an overall policy, but certainly what the law and the rules say is that the students and the parents and the guardians are supposed to be paying for it. Yeah.
Correct.
I have one more question. I had several parents call and had a question about the insurance carrier. They were unfamiliar with K&K, but I know that the way I read the update last week was that it was a continued service with K&K, and so is BMI going away, or
So K&K has been available to our students for a number of years. I don't know how many going back, but it's
Great.
been a long time. And it's a school insurance program that's available in all 50 states. The BMI insurance is the policy that Knox County Government Risk Management has secured for us to do as a whole. So it would go away because they would not take us as 1,000 football players versus the 7,000 athletes that we have total in the district.
Okay. All right, that makes sense. Great, thank you.
Thank you, Ms. Templeton. Ms. Christie?
Thank you, Madam Chair. I think that kind of is the disconnect, Brian. I think that when we talk about buying individual policies, we have to keep in mind BMI was a blanket coverage for everyone. So, which is very different from the K&K, right? I mean, it was.
Well, it was, except that we paid for it up front, and then
Right.
the families had to do it. So it really was individual policies. That's where it went against policies, because we were paying for an individual policy for those students to have that insurance to be able
But
to use.
that's why it looks different, though, because they give us a single quote, and that quote is based on every athlete we have in Knox County schools. correct.
In our sanctioned sports.
Right. So, and that was one of the areas where I guess I was struggling to understand the difference between the two. And after talking to you, it sounds like that quote may have, or there was potential for it to go up even higher because we brought on 2 new sanctioned sports, right?
Yes, the number that I was quoted for this year was upwards of $489,000.
Right. So that was just where I was kind of struggling with that disconnect as opposed to the K&K. I do appreciate you talking to me today. I also had a really good conversation with Mr. Pearson from KOC, who had reached out. If I will say this, if this policy passes, and I'm struggling with the financial aspect of it now, especially with the news we got last week with the freeze to federal funding, and I know everybody's trying to scramble to figure out a plan for that money, so that kind of changed my perspective a little bit on this. If this policy does pass, I would like to ask that we revisit it in the spring ahead of budget, just to discuss any maybe unintended negative consequences or where we landed, or how it worked or didn't work. But I'm struggling with this one a little bit for probably some of the same reasons everyone else is struggling. But also at the same time, I know that from a budget standpoint, we're in a very difficult place right now. So,
Thank you. Ms. Fontenot Ridley?
Thank you. I just am wondering if there have been any incidences where, because I know when I get hurt on the job, the first thing I check is, was this an injury on the job? Which implies that my insurance company is going to deny my coverage. Is there an instance where that could happen if they don't have private insurance and they have private insurance, but they didn't buy a policy, that who would be responsible for payment of that treatment?
I don't believe so, because the policy only was above and beyond their personal policies anyway.
Okay.
It was a supplemental policy.
So that you don't know of any instances where their personal policy covered so much or didn't cover any of it and it fell to the supplemental policy?
I don't know any specific examples to that. Gary, did you have something to add to that?
Well, I was just going to say, I can't talk in specifics either, but there's certainly been instances where a primary policy paid, but up to a certain amount, and then the secondary policy kicked in. I've certainly seen that happen. But to your question about workers' compensation, that would be different. Workers' compensation would not apply in this case. It would strictly be whatever health insurance.
I was just saying that as a kind of a reference
Yeah.
of insurance or what forms I fill out, they asked, did this happen as a result of a sporting injury or something like that? I wasn't actually going for workman's comp, but yeah. I just want to make sure that they get the best care, and if we don't know who's paying for their care, or who it would fall back on, I think we may have some gaps in treatment. I don't know, maybe. Thanks.
Thank you. Ms. Bike?
Thank you. I know it was just mentioned about support organizations paying for the supplemental insurance. Is that something that will have to be investigated, or is that something that could be answered now as to whether like a foundation or a band booster or like a sports booster club or whatever could pay these fees?
Is that a question to me, Ms.
I
Buck?
think so.
Okay, all right. Thank you. So in the law, it talks about, again, students and parents and guardians paying.
Mm-hmm.
It does not say anything about, teams or booster clubs or anything else paying. I think in reality, you see that happen because coaches and booster clubs like to help students participate, and you see fundraising and things of that nature, but it's not mandatory. And what the law says is that an LEA or can require payment for extracurricular activities, but it's specific to the student.
So if we're not requiring, so in part, this is not requiring supplemental insurance, but if we have this option and families wanted to opt into it, but were unable to afford it, would it be permissible for an organization outside of Knox County Schools to pay the fee?
One can always make a donation. I mean, I don't see anything legally barring one to voluntarily pay a fee.
Okay.
Yeah.
Last question. Next question. Do we track whether how many student athletes are potentially uninsured?
Well, they all say they are insured when they fill out their paperwork.
Okay, so that's the information that we have. So when they participate this coming year, they will have checked that box. If they do not check that box, or if they say no, they're uninsured, then what?
Then we would encourage them to purchase this K&K policy.
And so then that leads me to my next question is, this policy, is this something that, because it's been referenced as supplemental, is this something to where if they are completely uninsured that it will cover it?
I would have to find out more details of that coverage. I do know that in the case of VMI, when they did not have insurance, it became their primary insurance, but I can't speak to whether it covered everything fully for those people, because I know that it did not cover fully some of the additional costs, even as a supplemental insurance policy.
Do you think that is an answer that you might be able to have before Thursday?
I can work towards that, yes.
That would be great. Thank you.
Thank you. Ms. Templeton?
I wanted to walk through it like that. I needed to see the linear progression. So thank you for that. And so I was recollecting my thoughts. Because when I understand that level of coverage, when you're asking about would it default into the primary, that probably depends on the scale from 170 to 240 for a football player, 30 to 35 for everybody else. I'm assuming that the scale would impact that possibly. I don't know.
I will also state, as members of the TWA for all these programs, they have catastrophic insurance that kicks in when any bill is over $25,000. So our policy that we previously had covered the amount above their personal insurance up to $25,000 for most things, but it did not include all things in that.
Okay. I was actually going back also to Dr. Pearson's note. He said, with his numbers, he said, they treated 479 student athletes, 1,800 some odd office visits, 139 had no other form of medical insurance, and that's just the kids that went to KOC. Obviously, others would go elsewhere. For
Most of our
whatever
referrals go to KOC
They
because
do.
that's our trainers.
Okay.
They provide our trainers, which I want to state publicly we are very thankful for and love
For sure.
our partnership with KOC in providing those trainers to us.
Yeah, they are a dedicated,
They are.
selfless crew. Absolutely, definitely appreciate them and all that they do. I think I'm gonna yield.
Mr. Triplett?
Yeah, I think one of the things I'm trying to do, I understand the concern around students not being able to play. I understand why we're making the change in the policy. But I think we're trying to legislate something that most communities will figure out how to do on their own, and not in every situation, not in every case, but, where there's an athlete that doesn't have the ability to pay for their insurance, a lot of times you'll find a coach who loves a student or a family, another family that's on the team, or, that reaches out and says, hey, I'll cover the cost for you, let me let you play. I mean, I think we're trying to legislate and cover every single gap, and I don't know that that's really possible to do that. And so, to me, I understand why we're making this change, and I think it makes sense, but I don't know that we can, I feel like we're diving so deep trying to overthink it to the point where everything's covered perfectly, and I just don't know that that's possible. We just have to trust people to be good and do good when they have the opportunity to do so.
Anyone? Ms. Templeton?
Respectfully, I feel like that we have to think about all kids. And we can't assume that all communities can pick that up because they simply can't. And we need to do our due diligence on this board to make sure that every child from Farragut to Gibbs, Hardin-Valley to Gibbs, has the opportunity to play sports and learn all the lessons that are gained on the court, the field, the pitch, whatever it happens to be. So I feel like this conversation is valuable, and making sure that kids have this opportunity, whether it's through a school support organization, and maybe it's a situation that, the SSO is able to give grants to kids. And so I don't know, but not every school has an active SSO organization either. That has a bank account that can do that. So anyway, I just think it's a worthwhile piece of the conversation.
All right, anyone else? Okay. Thank you, Coach Brown. Appreciate you.